Assalamu alaikum. My name is Hassan Ahmed, and me with my fellow group members are here to present this topic, nonlinear heart rate control and treadmill exercises under the instability constraint. It is based on a research work which was authored by the following gentlemen, presented by us with my fellow members Sayyid Mari Shoaib and Afnan Ahmed. Now, first of all, let's talk about the basic concepts of this research paper, which is about the human heart rate variation, and the ergometric testing. First of all, let's talk about the brief introduction about the human heart. The human heart is an organ that pumps blood throughout the body via the circulatory system, supplying oxygen and nutrients to the tissues and removing carbon dioxide and other waste. The tissues of the body need a constant supply of nutrition in order to be active. In human, the heart is roughly the size of a large fist and weighs between about 10 to 12 ounces in men and 8 to 10 ounces in women. Now, before proceeding to the other topics of our research paper, first we need to understand about human heart rate and heart rate variation. So, human heart rate is the speed of the heartbeat measured by the number of contractions of the heart per minute, which is ppm. The heart rate can vary according to the body's physical needs, including the need to absorb oxygen and excrete carbon dioxide, but is also modulated by a myriad of factors, including genetics, physical fitness, status, diet, drugs, hormonal status, environment, and disease, as well as the interaction between and among these factors. The American Heart Association states the normal resting adult human heart rate is 60 to 100 bpm. Tachycardia is a heart rate defined as above 100 bpm at rest, and bradycardia is a low heart rate defined as below 60 bpm at rest. During sleep, a slow heartbeat with rates around 40 to 50 bpm is common and is considered normal. When the heart is not beating in regular pattern, this is referred to as an eurythmia, which is a disease. Now let's talk about heart rate variation. So HRV or heart rate variation is simply a measure of the variation in between each heartbeat. This variation is controlled by a primitive part of the nervous system called the autonomic nervous system, ANS. It works regardless of our desire and regulates, among other things, our heart rate, blood pressure, breathing, and digestion. The ANS is subdivided into two large components, the sympathetic and parasympathetic nervous system, also known as the flight or fight mechanism, and the relaxation response. The brain is constantly processing information in a region called the hypothalamus. The hypothalamus, through the ANS, sends signals to the rest of the body either to stimulate or to relax different functions. It responds not only to a poor night of sleep or that sore interaction with your boss, but also to exciting news that you got engaged or to that delicious healthy meal you had for lunch. Our body handles all kinds of stimuli and life goes on. However, if we have persistent instigators such as stress, poor sleep, unhealthy diet, dysfunctional relationships, isolation or solitude, and lack of exercise, this balance may be disrupted and your fight or flight. Now, before going to ergometric testing, we should know what is ergometry, which is basically a science that measures amount of work activity, specifically the measuring of the amount of physical work done by the body, usually during exertion. Ergometry is aimed at the performance of specific muscles or muscle groups and also includes a measure of power. And here we can see an ergometric device, which is ergometer, which is an exercise machine that tests the exertion exerted by certain muscles or that keeps track of how much of a particular exercise has been done. Now for the ergometric testing and its mechanism, my fellow group members would continue.
Bismillahirrahmanirrahim. This is second member of the group 6A. I am Sayyid Marushu, third year student. Now, I am gonna tell what is ergometric testing and what is it for. The answer to this is very simple. The ergometric testing is an instrumental examination that consists of recording the ECG during the examination of a physical effort. That is it. That is ergometric testing. what we basically do, we connect some things to the chest. I'm gonna explain the things, air code things, in the next few slides. We connect some things on the chest and we note the blood pressure and the pulse rate of a person while he is doing some taxing activities. Now, what is it used for? In this way, it is possible to select and define the nature of any heart disorders and allow a check for effectiveness of the therapy, establish a possible rehabilitation plan, and examine the response of the cardiovascular system to the exercise, certain sustainability for sports activities, and other cardiovascular aspects. During the physical exertion, in fact, the condition are realized that involve an increase in demands of the work to heart that could highlight any alteration not found at rest. It can also be considered the first choice instrumentation examination for the diagnosis of ischemic disease. This is ischemia basically, but it is a disease related to heart. See, we can use this ergometric testing to test the ischemia and other chronic heart disorders. Now, how does this test take place? The mechanism, the procedure for this test, how does it take place? We're gonna learn next. Now, the equipments required. What are the equipments required for to perform this test? Now, first of all, there is a cycle-ergometer. What is a cycle-ergometer? Moving back to the previous slide, this is basically a cycle-ergometer. The person riding it is a cycle-ergometer. It is a stationary bicycle in which the person can ride, and devices are attached to his chest. VO2 mask is attached to his face, and all the readings are being taken in and out. Second one is HR monitor chest strap. This is basically a chest strap HR monitor which takes in account the heart rates. Number third is a metronome which beeps. Number four is a stopwatch to check time. Another thing, number 5 is a sphygmomanometer to check the blood pressure and the pulse rate, and RP chart. RP chart is the rate of perceived exertion, which ranges from 1 to 10, 1 being very light activity and 10 being maximum effort of activity. Very light activity means sitting somewhere, eating something, watching a TV, and maximum effort in which we cannot even utter a single word. That is a maximum level of activity. Now, moving on. What are the pre-test procedure? What can we do to ensure that the test progresses perfectly? Number one, we obviously have to check all the forms and things required to put in on the values. Number two, check all the required equipment in hand to check the safety of to ensure the safety of the person riding the bicycle or the treadmill. Number three, we need to obviously calibrate the equipment. We also need the workload to be determined according to the client's gender and the physical condition, because not every person is same, so not all the criteria for a person would be same. Different criteria are for males, different criteria are for females, different criteria for athletes. Taking into account that particular thing, for male that are unconditioned, that are not athletes, we take 300 to 600 kilogram meters per minute resistance. For that is about 50 to 100 watts of power. For male condition that are most probably athletes, it ranges from 600 to 900 kilogram meter per minute, that is 100 to 150 watts. Unconditioned females, there is about 300 to 400 kilogram meter per minute of energy required, or about 50 to 75 watts. For conditioned females, athlete females, 400 to 600 kilogram meter per minute energy, or 75 to 100 watts of power is required per person. We also YMCA also recommends a 2 to 3 minute warm-up period to ensure that the muscle does not cramp under the physical taxation. Now, moving on to the test. What is the test? How we conduct it? What is the procedure? The aim is to achieve 2 consecutive workloads where the heart rate is between 100 to 110 to 110 bpm to 85% of the age predicted HR max. What is 85% HR max? This is basically the maximum heart rate of person is 85%. That is it. That is basically the 85 age predicted HR max. But how does this experiment progresses? We ask the subject to pedal for 3 minutes at his 85% maximum heart rate. That is being checked by the monitors. We record at every 2 and 3 minute interval. This is basically a 6-minute test in whole. And based on the steady heart rate, we can increase the workload, we can decrease the workload. We need to check the point at which the heart rate works at maximum, and we need to check the point at the range at which the heart rate slowly cools down. That is the last point. That is the last point in this cool down after the last stage has been completed. We need to check the in what way the heart is being cooled down. Now, how do we plot these things? The data that we have just acquired, we can use a graph in which the workload can be pointed at x-axis and the heart rate as plotted on y-axis. The plot the last two heart rates and extrapolate the line to the predicted maximum heart rate, and drop a line down to the point to read the predicted maximum workload on the x-axis. There are also formulas that can be used. This is a simple test to administer the reasonably accurate and appropriate ECG monitoring during the exercise. This is the advantage. There is also some disadvantage which we may learn. That is, the test score can be influenced by variability in the maximum heart rate in individuals. It would underestimate the fitness of those with a high maximum heart rate and overestimate the fitness with advancing age, as the maximum heart rate will age. Also, if it is performed on a cycle, it would favor the cyclist, and if it is performed on a treadmill, it would prefer the runner. That is it from my side. The next few slides will be presented by Afnan Ahmed. Thank you very much.
Assalamu alaikum. My name is Afnan Ahmed. I am a student of mechanical engineering department from NED University. I am in my third year. I am presenting to you about the experimental results and conclusion that we have derived from this report. So let's get started. First of all, we have experimental environment, which basically tells us about what parameters and conditions we set for these results to be taken, like how the tests were conducted. So as it shows on the screen, we used a DKN AM5 bicycle ergometer, which is a set of flywheels and magnets mounted. The distance from the flywheel is determined by the braking force, and there is also some algorithm used, and also we used another component which name is polar RMCM01 heart rate receiver component cyano transmitter. Also, we have conducted this test at 50 revolutions per minute, which is the running average speed. These are the parameters that were used to obtain the required results. So this is about. Now we are moving on to experimental values. These are the values which we use as an input to obtain our results. So first of all, we have values of A1, A2, A3, A4, as you can see on the screen. Also we were also changing the power. We started from 20 watts and then we moved in positive manner in increments of 10 watt until we reached 50 rpm. Now let's move on to the graphs. These graphs were obtained from the results we conducted. We plotted them so that the results will be easier to understand, and we can see patterns and like what is happening. So there are 4 graphs mentioned here. First graph shows heart rate
heart rate, and the second graph shows the workload, and the third graph shows the HR profile of a patient, which is basically shows a simulated behavior. The last graph shows it's a basically comparison between the first graph and another graph and another patients with different parameter set. So these are basically the graphs. Now let's move on to the last and final part of the presentation, which is the conclusion. Okay, now the conclusion just basically sums up our presentation. It just basically underlines and summarizes the whole presentation. So in this we basically made a non-linear model equation second order of derivative, which is basically modeled for a person's heart rate response during a long workout ergometer cycle, and we conducted results on it, and we conducted experiments on it, and then we got some results. So we were interested in the results, like what happened when we increase and decrease the workload. So after seeing the results, I think it can be mentioned and said about that we can really use the heart rate profile to solve many problems, like for athletes and patients, and further studies can be done on this. So we have a much better understanding than we have now of the heart rate response to the long duration of exercises. That's all from me.